viewers, or within the aesthetic corrections we essentially perform in leg aesthetics, or among the deformities we encounter, the leg being in a parenthesis-like crooked configuration, are problems we frequently encounter. In addition to this, we also face issues like the leg being excessively thin or conversely too thick. To be honest, here, fundamentally regarding how to correct the deformity of a crooked leg, meaning the leg being in a parenthesis shape, I will try to enlighten you a little bit to try. Fundamentally, we can perform aesthetic correction for the parenthesis-shaped crooked leg appearance using two methods. The first of these involves the use of silicone implants, while another technique is fat injection, primarily in cases where the degree of deformity is slight, or in instances where the leg appears thin alongside some degree of crookedness. I tend to favor fat injection more often. But for cases where the deformity is very evident, we must utilize silicone implants to reach a definitive resolution. However, in some cases, by combining silicone prosthesis with fat injection, we can get better, clearer results for the overall look. Thus, in every scenario, I wish for you to be aware that your findings from the physical examination are extremely significant for correcting leg aesthetics, especially with patients getting fat injection while we fix the leg crookedness or thinness problem. At the same time, if your body has abnormal localized fat accumulation, you will also get rid of that at the same time. Our surgery time is about half an hour to 45 minutes, sometimes around 1 hour. You might be discharged the same day. For silicone implants, usually based on the patient's wish, we can do it with spinal anesthesia, numbing the waist, or with general anesthesia too. We can do it. Our surgery time averages 40 to 45 minutes. And entering from behind the knee, from the knee crease area, we place the silicone implant under the muscle fascia or inside the muscle. The crucial point of this surgery here is that for the patient to be comfortable after the surgery, when coming to the hospital during the surgery, I always ask my patients to come with high-heeled slippers or high-heeled shoes, particularly during our initial mobilization following the operation. When we first start to move and commence walking, even briefly, we can be very comfortable in high-heeled slippers or shoes. Of course, the silicone implants we use here are lifetime prostheses, as some patients ask. Therefore, you will be able to live happily ever after with this. You will be able to commence engaging in sports and exercise according to your desires about 2 weeks following your operation. For you to reach the final state, meaning for your prosthesis to fully reflect and for your leg to look aesthetically perfect, we need a time period of approximately 3 weeks to about 6 to 7 weeks. Because as the muscle fascia slowly relaxes, we will see the effect of the silicone prosthesis more clearly. And we will see its benefit. Fundamentally, when we look at it, I can say that it is a very easy surgery. I can say that its effect and benefit are very clear. Unfortunately, since it's not a very known surgery, both my colleagues and my patients have some worries, especially about leg aesthetics. However, I wish to convey to you from the bottom of my heart that there is no need for fear.